Me five people on the Zoom.
Good night, everyone. Welcome. Thank you for joining us. We apologize for the delay. There were some technical difficulties to work through, but those have finally been resolved, so we can begin. Let me just welcome those who are joining us via Facebook, YouTube Live, and those of you who are here with us on Zoom. Now, as you would have known by the title of the program tonight, Plan Your Fam. It's all about the family and family planning. And this is such an important, it's a popular, very trending topic, regarding women's reproductive health. And this session is going to really educate us on a number of aspects relating to family planning and the use of different types of contraception. We have a special speaker with us who will be joining us shortly. So while we wait for her to arrive, I'm just going to give you a backdrop of our group, our support group, what we do, how often we meet, and just give you an update as to how we've been progressing thus far. My name is Alicia Jogma-Hunsing. I am representing the Arouca SDA's New and Expecting Mothers Support Group. This was an initiative started by Sister Susan Douglas, who is the Women's Ministry Director at Arouca SDA Church. And she recruited a number of ladies from within the church and from within the community to be a part of this group. We have been going strong for a few months now. I believe it was at the start of the year that we came together as mothers and those of us who are expecting. And we meet the last Thursday of every month. We meet on Zoom, and usually we would encourage each other, share stories, just basically be a motivation to all of the other mothers so we can be encouraged to keep doing what we're doing, right? We also have sessions where we would educate the mothers. So sessions like these where we would have guest speakers to come educate on various topics such as breastfeeding, weaning your baby, postpartum recovery, those kind of things. So it's been quite enriching. I have to say, as a mother myself, I have a 11-month-old and he is a handful, but I've learned a lot being a part of this group. And I'm very grateful for the information that has been shared by past presenters. We've had nurses, we've had midwives come on our program, and it's been quite an insightful experience. So tonight, I will just give you a backdrop of our speaker because we're still waiting for a speaker to arrive. Let me just introduce you to who will be speaking to us tonight. So we have Dr. Lukaya Livan. She is an SDA Christian who attends the Evergreen SDA Church. She's passionate about sharing the gospel, and one of her passions in life is medical missionary work. She's a wife, she's a mother to a handsome 2-year-old boy. Dr. Livan is currently the registrar in obstetrics, and gynecology at the Sani Grande Hospital, and she's been working in this field for the past 12 years. So she's quite experienced and very much equipped to discuss the topic of family planning. So while we wait for her to arrive, let me introduce you to some of the members of the team. They may not want to come on camera, but I'm just gonna call their names and get you familiar with the members of our group. Just bear with me a second. So I don't miss anyone. Okay, so we have Alina Palmer, sorry. She is, I think she's the one mother we have in the group who is currently expecting. So she has been sharing her pregnancy journey with us, and of course, all the other mothers are giving her all the encouragement and support as she goes through this period. We have Tyrian. She has a then 4-month-old when she joined, but I'm sure that baby is much older now, right? Tyrian, about, I would probably say 6 months. Correct me if I'm wrong.
She's 7 months, should be 8 months the 1st of August.
Right. Look at that. Time flies, right? Because she was just about 4 months when we started the group. We have Shanti. She had a 5-month-old at the start of the group. She's here with us so she could give us an update on age of her baby.
Hi, good night, everyone. He's currently 8 months. He'll be 9 months on the 30th of this month.
Right, very close to Tyrian's baby's age. Lovely. And we also have Leoy with us. Leoy has then a 6-day-old, but no longer a 6-day-old baby, right? Your baby is now in the months. Lee, just give us.
Hi, good night, everyone. Yes, so he's 3.5 months old.
Great. 3.5 months. We have Desma. She's not on the meeting tonight, but she's very much an active member of our group. We also have some new members that joined us recently. So let me make sure I get their names correctly. Desma, Tyrian, Tamaya. How could I forget Tamaya Murray? Tamaya Murray is one of our young mothers as well. Her baby is very young as well, I believe. Probably maybe 2 months, if I'm not mistaken, but don't quote me on that. Right? I just want to make sure I don't miss out any of the other mothers. Right, we have Nikki Shea. How could I forget Nikki Shea? She is the daughter of our women's ministry leader, Sister Douglas. So her baby is a few months old. I can't recall the exact amount. She's not with us tonight, but again, she's also a very involved member of the group. We have June Alexander as well. And I believe I covered, we have Shelby. Great. And I see our presenters with us. I'm so happy to see your name pop up in that list there. I was just introducing everyone to the members of the New and Expecting Mothers Support Group. And I'm gonna hand over to our in-house doctor tonight. I already introduced you. Sorry you missed it, but they're aware of who you are and what you are going to discuss tonight. So we're already 18 minutes past 8, so you can begin as soon as you're ready. Thanks again for being with us.
So, hello, can everybody hear me?
Yes, we can hear you and we can see you. Lovely.
My apologies. I was having some technical trouble and I was like, oh my gosh, I'm so late. I am so sorry. I was having some trouble with Zoom, so my apologies. So I wouldn't.
Completely understand. We were having some issues of our own as well, but okay. I'm glad everything is resolved and we can finally begin.
Great. All right, so we'll get into this evening's discussion. I am Dr. Lukaya Livan, and the hostess would have introduced me already, so I would not go into that. So I must thank all of you for inviting me here this evening. And the discussion would be an informal one. I would try to be as simple as I can. And of course, you can feel free at any point to interrupt me if you don't understand what I'm saying or you're not hearing me too well. And I would be happy to stop or repeat. Yeah. So this evening, I was asked to discuss contraception. And what contraception is, it's a deliberate use of artificial or other means of preventing a pregnancy, yes, as a consequence of sexual intercourse. So you are deliberately preventing a pregnancy from occurring. Now, birth control is a term that is basically used synonymous with contraception. So you would hear me interchanging those two terms. That either use contraception or I may use birth control. It's the same thing. Yeah. So contraception or birth control can be divided into two types. They're either reversible or irreversible contraception. Now, the reversible forms of contraception could either be long-acting or short-acting. And then there is the irreversible type. So I'll go into each type briefly. So for the reversible types of contraception, as I said, there's a short-acting and long-acting. Now, when you think about contraception, and the name would imply a short-acting form of birth control or contraception, basically you would have contraceptive coverage for a short period of time or a short window, right? Some examples of short-acting contraception would include the use of condoms, the oral contraceptive pill, we can use like the natural rhythm method, you know, where you would actually time sexual intercourse when you are ovulating. And at that point, you would know, well, this is your fertile period, and you would avoid that fertile period. And that too is a short-acting type of birth control. And then there are long-acting reversible forms of birth control. And these would include the Depo-Provera shot. That's the injection that they would give every 3 months. There is the intrauterine contraceptive device. That's the copper T or the coil that it's more commonly known as. There is the Marina, which is also a form of intrauterine device or coil, but this one has hormones in it. Yeah. And that too is a long-acting reversible form of contraception. And there is the implant, or the patch. These are placed just on the skin, yeah, and that's used for a long period of time as well for contraceptive effects, right? Now, each of these long-acting reversible types of contraception, they have a time period where the effect of the contraception is. So I spoke to you about the Depo-Provera or the injection, right? And that effect lasts for 14 weeks, okay? So it's about 3.5 months, thereabouts. And you are required to go every 12 months to get 12 weeks to get the shot. And if you would have, say, forgotten to go within the 12th week, you have coverage or protection for at least 2 more weeks. So within 14 weeks, you basically have protection from pregnancy. Then I spoke to you about the coil, and the two types, we have the Marina Coil, which is it's like a little tea, and it's inserted into the womb, and that has hormones on it. And the contraceptive effect lasts for about 5 years. So within 5 years, we insert the device, and it gives you contraceptive protection for 5 years. The copper T, which is a similar intrauterine device, it's placed inside of the womb. That does not have any hormone in it. It's made of copper, right? So that, Go ahead.
No,
Somebody had a
continue. I
question?
think someone just joined and their audio was on. So
No problem.
continue. Yes, sure.
Sure. So the copper doesn't have any hormones in it, and it's just the actual copper material of itself renders the contraceptive properties. Yes, and that contraceptive device lasts for 10 years. And then I would have mentioned the implant or the patch. The implant is similar to the injection, the hormone that's used for the injection, as well as the Mirena, right? The similar hormone is the implant is laden with that particular hormone, right? And there are two sort of they're like matchstick devices that is placed just under the skin, and the effect of it could either be for 3 years or 5 years, right? So the effect of the long-acting reversible contraception is for a long time, hence the name. And another form of long-acting reversible contraception is a vasectomy, right? So a vasectomy is a surgical procedure where your partner, your husband, right, would have a particular tube in the reproductive organ that is usually dissected or clipped, and that prevents pregnancy. So the male can also be a part of contraception. It's not just the onus being on the female, okay? The other type of contraception would be your irreversible or your permanent form of birth control. And
Hi. So can I interject before we go on to the
Sure.
irreversible?
Mhm.
I just want to say, I mean, if there are any questions, because I know it's a lot of information and it's very useful information. If you
Yes.
have any questions on what that category of birth control, the reversible. So you spoke about long acting and short acting.
Yes.
Please interject. You could post in the chat in Zoom or on YouTube if you have any questions. I had a question, and you might have to go back to the one for 5 years. I think it's called copper. Is it
Right.
copper T?
No, that was the Marina Coil. The copper T is
Right.
for 10 years.
For 10 years. That's really long for something to continue to be effective for such a long and extended period of time.
Right.
I mean, how effective is
How does it work?
Yeah, because
All right.
you explain it's inserted into your body, right? Is
It
this
is.
the one beneath the skin?
No, this is the one in your womb.
In the womb, and it doesn't
Right.
come out at all. It
All right, so
remains there.
Sure. I'll tell you a little bit about
I'm
how they
curious.
work.
Right.
Sure, no problem. I'll tell you a little bit about how they work, and it's a really good question that you asked. So both the Mirena Coil and the copper T, right? Both of them are inserted in the womb. All right. Now, the woman is required to check for the string. So both of them, they are fitted with a string to the end. So you feel to ensure that it remains in place, right? Because sometimes it can shift. The question you asked in terms of the copper T being there for a long time, it's how it works. That's the benefit of it lasting for that long. Now, it's a foreign object, yeah, being placed in your body. And your body has a way of not liking when foreign things go in our bodies, right? So the copper T acts by causing the lining of the womb to become very hostile, right? The lining of the womb, every time we prepare for menstruation and every time we would have ovulation that would occur, your body prepares itself monthly to receive a fetus, okay? Now, when we place this copper device into the womb, it gives off toxic or harmful, not harmful to your body in the sense of it causes your body to be poisoned or anything like that, but it causes the lining of the womb now, an environment that is not accommodating, that is not accommodative for a fetus, right? So little by little, over a period of time, the copper that is there would release and cause the lining of the womb to be hostile, for want of a better word. Yeah. And that effect lasts for over 10 years. Now, after 10 years, the effect is no longer, it doesn't work anymore after 10 years. The good thing, and the reason why they are called reversible, is once this device is removed, your fertility is returned immediately, except for the injection. The Depo-Provera, the one that is given every 12 weeks, right? That's the only reversible one that your fertility takes a little longer to return. It takes about a year for your fertility to return. But all the others, your fertility returns immediately as long as you stop using it or it is removed from your body. I hope that answered your question.
Yes, it does.
All right.
Very informative, and it's very enlightening because I had no prior information about that particular type of contraception. We have a question in the chat.
Sure.
The question is, how does a vasectomy affect male performance and satisfaction? There's about 3 parts of the question. So how does it affect male sexual performance and satisfaction? What are the complications involved? Is it reversible? What is the cost to have the procedure done and undone if possible? So I can repeat the questions as you go along. So you can attempt the first one
problem.
about
Sure.
the satisfaction.
So disclaimer, I am not a urologist, and that is a question for a urologist. But I would answer to the best of my knowledge in terms of the fertility aspect. Because of course, as a gynecologist, we would be asked certain questions. So forgive me if some of the answers I would not give you because it's not my specialty. So when it comes to vasectomy and anything to do with that particular organ, a urologist is a specialist that is involved. So one, the vasectomy does not affect whether sexual performance, right? It doesn't cause the man to be impotent, as far as studies have shown, and it is reversible. It is 100% reversible. So another thing is this procedure is actually quite simple, and it's done in an outpatient setting. And we generally would encourage the partner to do the vasectomy rather than if the patient or if the couple, they're looking for a more permanent form of contraception, we tend to nudge them in that direction because, as I would go into a little later, the irreversible forms of contraception is basically a surgical one, and the risks are greater for the woman compared to the male. So to answer your question, I can just more or less answer about 2 of them, which is yes, it's reversible. And I'm not sure of the cost, yeah. And I know that it does not affect performance in terms of sexual activity.
Okay, and then she asked about, are there any complications or known complications by having this procedure? And okay, well, you spoke to the cost situation already.
I can't answer the complications.
Right.
What I can say is anything that involves us going into your body cavity or anything like that, there are always risks associated with it. And the disclaimer is I'm not a urologist, so I apologize. I can't off of my head tell you what some of the complications are for a vasectomy. So I could probably tell you at another time, but I can't at this time. So sorry about that.
No, completely understand. So I hope this answers your question. So you can go ahead with your presentation. Thank you.
All right, great, no problem. Right, I was gonna get back to how we would some of the complications and the side effects of the contraception after I speak on the irreversible form of birth control. So the only irreversible form of birth control that is available is the bilateral tubal ligation, or it's more colloquially known as tying your tubes, right? Now, the bilateral tubal ligation, or tying of your tubes, basically is a surgical procedure. It involves us taking you to the theater, making an incision or a cut, either a cut in the tummy, locating the tubes, and basically tying them, right? Or it can be done laparoscopically, where we go through the navel, we take a camera, we identify where the tubes are, as the fallopian tubes, and we tie them. Now, your fallopian tubes are two tube-like structures that connect the ovary to the womb. And the tube is responsible for transporting the egg and the sperm, and there is where fertilization occurs. So it stands to reason that if we want to prevent fertilization from occurring, we need to basically sever that connection. And that's what we do during the bilateral tubal ligation. Now, any surgical procedure has risk. There is the anesthetic risk, meaning that the medication that is used to prevent the patient from having any pain during the procedure can cause complications. If we put you to sleep, meaning that is general anesthetic, then some people may react to the medication and can have unwanted side effects. There are surgical complications. So infection is one of those complications, bleeding, damage to certain structures around where we're going to cut. So it's not just a simple thing to say, okay, we're going to tie our tubes and that's it. We generally would counsel or speak to women at length, explaining what can go wrong when we do surgical procedures. What also is of note is that the bilateral tubal ligation, yes, it's irreversible, meaning we can't untie your tubes once we tie it. So once you have decided that you've completed your family, you no longer want any more children, and the more permanent or irreversible form of contraception is what you desire, we would explain to you that if you decide to change your mind, say 5 years down the line, you decide, oh, you just really, really want this last child. Unfortunately, at least not in the local setting, can we untie or join the tube that we would have cut. Yeah, so it's irreversible. We can't untie it. We can't undo what we would have done. Now, in the more developed nations, there are micro surgery, micro cannulization, they call it, where they reattach the tubes. That's done like in the UK, the US, but it's not done locally. So we advise patients that this is something that you need to be absolutely certain about, because it is a permanent form of birth control. With that being said, in life, there's nothing that is 100% certain or 100%, 100%, what's the word? Complete. Now, when we do this procedure, there is a failure rate, right? And I would go back to the contraceptive options I spoke of earlier and tell you about the failure rate. What is failure rate? So what is the failure rate? Now, whenever we offer birth control, there is always a chance of pregnancy. And once pregnancy results while on a contraceptive device, that particular contraceptive device will have failed, right? So with all forms of birth control, there is a failure rate. And with the BTL or bilateral tubal ligation, there is a failure rate of 1 in 200. That simply means that if we would have tied 200 women's tubes, one of them could actually become pregnant. And the pregnancy can occur in your tubes, and that's known as an ectopic pregnancy. So it's not very common that this would happen, but there is still a failure rate. If we go back to the copper device and the Marina, which is the devices that we insert in the womb for contraception, they actually have a better failure rate, meaning that compared to tying the tubes using the contraceptive devices in the womb, you have a less chance of failure occurring. So there is a 1 in 1,000 failure rate using the copper T or the Marina. And in terms of the implant, it's more effective. So that's like 1 in 2,000 in addition to the vasectomy. So vasectomy and the implant are the most effective forms of birth control that there is. Yeah?
Okay, I have a question.
Sure.
So you mentioned the tying of the tubes. There are different ways the procedure can be performed. Spoke about incision in the tummy. And then you spoke about going through the navel as an option as well. The incision in the tummy, if someone has had a C-section prior, there any complications that could happen with someone who was cut previously?
Okay, that's a good question. Now, anytime you've had any form of surgery, there is the risk of damage to structures. There's the risk of us having a difficult time getting into the womb because of something called adhesions. So adhesions are basically the tissue being stuck together. So once we go into your tummy and we touch tissue, right? We cut tissue, we do any manipulation at all with tissue and organs, they can stick together, and that is known as adhesion. So they become very tough, so they can be very fibrous. And when we go in, it can be very, very difficult for us to get in. And in terms of things being stuck together, your organs like your bladder or your bowel, could be stuck to areas where we're going to cut, and that increases your chances of damaging those structures. So before we even embark on doing surgery, we advise patients that, this can happen. Sometimes even without doing surgery, there is still the chance of adhesions. For example, if you would have had an infection in the past that you weren't aware of, that too can cause tissue to be stuck together, and adhesions can form, and it can be difficult for us to enter as well, and damage the structures can occur. So we usually would advise patients, with counsel them, tell them that these are risks. And before we do any surgical procedure, you are required to sign an informed consent. Informed meaning we inform you of all the risks that are associated with this type of procedure. And if you want to go ahead or allow us to go ahead with the procedure, you are going ahead knowing that certain things can happen. Yeah. And if you choose not to go ahead, you say, okay, we're not willing to accept those risks, I don't want to have the surgery anymore, that's perfectly fine. But you are informed of what can go wrong, and you go ahead signing the consent knowing that this can happen.
Okay. And is there any assessment that could be done on a woman's body to determine, what impact it might have? prior to going to surgery? Any kind of scans or is there anything you would know? There would
Unfortunately,
no.
no. Unfortunately, no. We can't tell from beforehand if a woman has adhesions. What we can tell is your risk would increase if you would have had surgery before, right?
Like a C-section.
Yes, for example, if you would have had a
Right.
C-section before, if you had an appendectomy, if any sort of surgery where we went now, we manipulated tissue and organs, there is,
Right.
you are now in the category of high risk for certain things to happen. Yeah, but if you've never had surgery before, then it's unlikely you would have had adhesions. Now, as I said, you may have had an infection in the past, and maybe they never know you had an infection, and then we go in,
Right.
and it's like, wow, it's real crazy in here, you know. But we can't tell from beforehand. No.
Okay. All right. Understood. Thanks.
All right. Good. So, right, back to the contraception we had before. Right. So, in terms of the short-acting forms of contraception, I would have mentioned the combined hormonal contraception. That would include like your birth control, your oral contraceptive pill. The oral contraceptive pill can either be a combined pill, meaning that it has two different types of hormone that makes up the pill, or it can be just a simple pill. For example, it can be just with one hormone, an estrogen alone pill or a progesterone alone pill. Now, what are these terms? Your body, right, has various hormones or chemicals that help the body function in a particular way. And as women, we have hormones that are responsible for our reproduction. Progesterone and estrogen are the two hormones that are basically responsible for fertility. They're responsible for your menstrual cycle, it's responsible for ovulation. And what scientists or pharmaceutical companies would have done is try to mimic how the hormones act in your body, and they made pills, right, to help sort of stop certain actions of hormones so as to achieve contraceptive effects, right? So the combined pill, right, can be used. The reason why it's short acting and reversible is some people may use the pill for, say, 3 months. Some may use the pill for a longer period, but it's a pill that it's a form of contraception that is only used for, say, 1 month at a time, right? So hence it falls in the short acting category. Now, when we think of the contraceptive pill, we would have to consider who is a candidate for using the pill, because not everyone we would recommend the contraceptive pill for. Now, people who are at risk of blood clots or who have had blood clots in the past, we don't recommend the oral contraceptive pill. People who smoke, we don't recommend the contraceptive pill. People with a family history of blood clots, people with active cancers like breast cancer, cervical cancer, people who have active liver infections or liver cancer, we don't recommend the contraceptive pill, only because I would have mentioned the estrogen in it that causes or that increases your chances of blood clots, and it can also cause the cancers to basically get worse than it is. So certain categories of people, we do not recommend the oral contraceptive pill, and we would recommend using another form of birth control. Yeah. The condom The condom is a form of birth control that we would class as a barrier type because it's used on the outside. So it goes, well, that's the male condom, that is, because there's a female condom as well. So the male condom is placed on the penis. It has a twofold function. So it acts as birth control once used correctly, and it also helps to prevent sexually transmitted infection. It is short acting because we use it for a short time. It's one time use basically. We use it for that time, and that particular period that is used for contraception is achieved once used correctly. And right, of course, the natural or rhythm method. This is the form of contraception that has the highest failure rate, right? Because one, sometimes your periods are not regular, right? You may miss the time that you ovulated and hence become pregnant. It also is a form of birth control that you have to be very precise in recognizing when your fertile periods are. So this makes it one of the highest, the method of contraception that has the highest failure rates. Yeah.
Okay. Question. If I could just
Sure.
backtrack to the pill, because you said the pill is short acting.
It
Yes?
can be short acting. Yes.
It could be short acting. What is the recommended or the maximum consecutive amount of time, I guess, would you recommend that a woman take the pill or be on the pill for?
Sure. Now, the pill can have dual functions. We can use the pill to help with menstrual disturbances or menstrual irregularities, or we use it for birth control. When it's used for birth control, it can, or it's actually recommended to be used on a continuous basis, right? Now, there are different preparations of the pill. There are certain types of, there are some types of pill. Well, let me rephrase. The oral contraceptive pill could either have a preparation of 21 days, 20, or 24 days. That means that the active pill, meaning the pill that has the hormone in it, you use for 21 days. You have a break for 7 days where you stop using the hormone and you would have a period, right? Or there is the 24-day preparation where the active pill, meaning the pill that has the hormone in it, is for 24 days, yeah? And then you have a 4-day break. The 21-day preparation would include the older type of birth control pills, sort of like Diane 20. So yeah, the Diane 20, the Yaz, yeah, that's a 21-day preparation. They have newer preparations like Clyra. That one is more of a 24-day one, right? So for birth control, you can use it. It's recommended that you use it continuously for as long as you want not to be pregnant, or for as long as you want the contraceptive effects of the pill. Now, if you're using it for menstrual disturbances, sometimes you would have you use it back to back, meaning that you have no pill-free breaks, meaning that we don't allow for a period to happen. So you would use the pill continuously for like 3 months or sometimes 6 months, and you don't have a break. So some women may have a period like 4 times for the year, because if you're using it for 3 months consecutively, there is no break. So then you have no period. And when you do have the break and you have the period, say it's every 3 months, then you have a period 4 times for the year. So for contraception, we don't recommend it that way. We recommend it with the break, where you have a period and then we do it the next month and so on. And you use the pill for as long as you want contraception for. Yeah, but as long as you decide that, okay, I don't want to use this contraception anymore, then you can stop and your fertility is returned immediately.
Okay, great. And there are no adverse side effects for like extended use, let's say using the pill for 5 years or 10 years. In your profession, have you seen patients complain of any complications of extended use?
Okay, so that's the concern that a lot of women have, using the pill for a long period of time. What effect is going to have on my body? Based on my experience and based on the literature and the research, long-term use of the contraceptive pill has not shown to have any adverse effects. In fact, it has protective effects. It has been shown to protect the woman against ovarian cancer. And how it does that is because you are not having ovulation. Now, every time you ovulate, right, an egg basically pops out of your ovaries. Sorry, it pops out of your ovaries and it causes damage, right? And what happens is when you are using the pill, you're not having ovulation. So they seem to link the fact that you're not ovulating on the pill to the protective effects against ovarian cancer. What is most concerning, as I would have mentioned earlier, with the contraceptive pill is the risk of blood clots, right? And that risk is highest when you just start using the pill or if you switch from one pill to the next, right? So for example, if you are using, say, Yasmin and you decide to switch to Yaz or Clyra, those are different strengths, right, of the contraceptive pill. Then your risk of a blood clot would increase changing, switching pills or now starting. But once you've been on the pill, that risk decreases significantly with each year that passes. The risk of a blood clot is actually 60 times higher in a pregnant woman than it is with a woman using the pill. So you can get a blood clot and die being pregnant than using the pill. So that is the most concerning thing about the pill that women are concerned about. Oh, I can get a clot, doc. I can get a clot if I use this. Yes, that's why we categorize people. We look at your risk factors. So if we know that you're at risk for a blood clot or you have a family history of, we wouldn't recommend using the pill. But if you're low risk, yeah, then we say you getting pregnant puts you at risk 60 times more than if you were to use the pill. So what do you prefer? And then after I tell them that, they'll be like, okay, you can give me the pill.
Okay, understood. Do we have any questions from anyone else before you continue? I'm going to let you run through the rest of your presentation, and then at the end, we can take any other questions.
I'm actually finishing up now, so I don't have much more. So
sure,
that's okay if they ask.
So if nobody has any question now, we could let her proceed, and then I'm not seeing any hands raised, so you can continue, and we will catch up at the end.
No problem. Thank you. Okay. Right, so we spoke about the contraceptive pill, the condom, rhythm, method, the implants, and tying of the tubes. Yeah. So that is basically what I have presented, prepared for this evening. It wasn't intended to be long. It was more, interactive and just basic, common forms of birth control and the effects of it. I am hoping that I covered everything, and if I didn't, then I guess it will come out in the questions that you would have for me. I am happy to answer any questions at this point, and thank you so much for listening.
Thank you. Thank you so much. What a very thorough presentation. Very informative and very enlightening. So any hands? Anyone would like to raise a question?
No.
Kimberly? See your mic unmuted.
Oh, no, no, no.
Oh.
No, no,
Okay.
love.
All right, sure. So there are some questions I would like to ask you. And these may be
Sure.
questions persons may want to ask, but maybe shy to ask certain questions or not comfortable asking questions. So I'll just ask it on their behalf.
No problem.
If someone takes the pill while they are pregnant, is it going to harm their baby?
The pill, just the pill or any form of birth control?
Just the
Okay, pill.
so let's say any kind of hormonal contraceptive. Let's just broaden it instead of just saying the pill. Yeah.
No problem. That's a good question. And the answer is, so far, research has shown that no, it doesn't. So I have actually had cases where someone would have probably forgotten to take the pill for some reason or the other, and they would have fallen pregnant. And of course, they would have had taken the pill before, and nothing happened to the baby. So studies have shown that getting pregnant on the pill does not harm the baby in any way. What I can tell you though is sometimes women can fall pregnant with the contraceptive device in the womb, right? And the thing about that is there is a risk of miscarriage, right? If the woman falls pregnant and the contraceptive device is in situ or in the womb still, there is a risk that if we remove the contraceptive device while the patient is pregnant, the woman can miscarry, right? So we generally would tell the patient that this is a risk. If you want us to go ahead and remove it, or if you want us to leave it. Now, if we leave the contraceptive device there is also a chance that it could go and puncture the water bag. It could go into the afterbirth. It could migrate and these things. So some women, they would opt for us to remove the contraceptive device in the first trimester with the risk of a miscarriage, and others leave it and go on to have successful pregnancies. So that is just worth mentioning. But in terms of harming the baby with contraceptive pills, no, studies have shown that it does not.
Okay, great. Noted. So someone may also want to know when I stop taking the pill or the injection, how long after can I get pregnant? I think for one of them you mentioned a year, but I don't think it was referring to the pill.
So for the pill, yeah, the pill is immediate. All the other forms of reversible contraception, as long as you stop it, you remove it, then fertility is immediately restored, right? The only exception would be the injection. That's the Depo-Provera, the one that is given every 12 weeks or 3 months. That takes a little longer. Some women, may have their fertility returned, say about 3 months or so after stopping. That's very, very rare cases. But generally, the delay is about a year, 10 months to a year. So that's the only one. If you plan on having a baby within a year, less than a year, then we don't recommend that form of contraception because your fertility can be delayed.
Wow. I'm so glad we had this conversation. This is very, very important information you're sharing there. Okay, so I'm gonna jump to the question regarding permanent family planning solutions. You spoke about vasectomy, which is a form of sterilization, right?
It is, yeah.
Right.
That's male sterilization.
Right. You mentioned about some couples may come to you saying they want permanent solutions, but are there any cases or circumstances where you may recommend that against the couple's wishes?
Right. Excellent question. Excellent question. Now, pregnancy is not for everybody. Pregnancy is not for everyone. I know that the majority of women, their desire is to become pregnant, but pregnancy, honestly, is not for everyone. There are cases where pregnancy can actually kill you. cases where there is certain heart conditions. Yeah, some women are born with heart issues. Yeah, and if they do become pregnant, they can die. Right? Certain medical conditions can kill you. So, as a physician, we would advise against becoming pregnant. Right? Um, in these cases, we would strongly recommend, contraception and maybe permanent forms of contraception. But again, we cannot force anyone to do anything that they don't want to do. What we can do is present the pros and the cons. We would present what can go wrong, and with the options that are presented, then you make an informed choice. So we say, yes, this is what you want, but this is what could happen. And we strongly recommend that you do not get pregnant. However, if they still want to go ahead, we can't do anything against anybody's wishes. So yes,
Understandable.
there are
And
cases
I'm
we
sure
would recommend.
I'm sure as a physician, that's probably a very difficult conversation to have with your patient, especially if they are
Oh,
very
it is.
eager to, start a family or expand their family. But it is important that you be
Definitely.
honest, right?
Definitely.
To save their life. So I'm going to end off with a
Correct.
question that may come across as a controversial question. But you mentioned that the natural method has the highest failure rates, right? Yes, you mentioned
Yes.
that. So what would be your response to couples who believe that, contraception is interfering with God's natural selection, that process, and they may prefer to, go in the natural route and veer away from any kind of artificial medication and that kind of thing. What are your thoughts on that? And then we'll take Terrian's question after.
Okay, as in that they do not want any form of contraception, or they
No
would
form
do
of
the Reversible method?
contraception,
No form of
because they link
That's
it
not
to
what
a
God
religious
intended.
belief that it's interfering with, the natural reproductive nature
Right.
that God has given us.
That's a very nice question. And to be quite honest, I have been faced with a situation like that. And I generally would let people know that I am a practicing Seventh-day Adventist Christian, meaning that I believe in the Bible, I believe in God's word, I believe in the fundamentals of Christianity. And when I speak to patients, I speak to them from that perspective, not just me being Dr. So-and-so, but me being a practicing Christian. That being said, I generally would tell patients that you have the right to your belief. I never try to impede, or I never try to push my philosophy or my principles on anybody. But what I do is I tend to use logic to it. So I would say that when God spoke to Adam and Eve, yeah, I believe that's when he told them to be fruitful and multiply. Go, and this is what you were created to do. In addition to worshiping me, I said, go and bring forth. So I'm thinking, okay, this was before sin. This was when it was Adam and Eve, the only people on the earth. So at that point, we need to replenish the earth, right? After sin, fallen man, would you logically want to bring human beings into this world of sin? One. Two, God is not a God who is draconian, or who is this, slave master or whatever. So you, while yes, he did give the command for us to go forth and to do this, you still have to use logic as well. you have a spouse who, for example, has 7 children. Now, your body, after a certain amount of children, you can face many complications with subsequent pregnancies, anemia, risk of death. As a loving spouse, as a loving husband, wouldn't you want to, do what's best for your wife? So I would offer, my opinion in terms of this. Also taking into account the person's views and hear what they have to say. But from my point of view, I honestly believe that God gave us wisdom. Yeah. And we ought to practice our God-given wisdom and look at things in terms of what is applicable for our time, what is applicable for now, this dying world, this world of 7 billion people. I mean, come on. Yes,
Understand.
children are good, but
Right.
yeah.
Yes, I love that you use reason with your patients, and you try to get them to have think logically and think
Yes.
of what's best for their significant other. So that's very valuable. So we have a hand, Terian, then we have a question in the chat, and then we're going to wrap things up. All right, so Terian.
Sure.
Hi, good night. I have
Hi.
2 questions. One is with the tablet, right? What is the age range, right, for women taking the tablet, as well as how does the IUD, which is the copper T, affect women menstrual cycle?
Okay.
Yeah, thanks.
Sure, no problem. So I'll answer the first question. The contraceptive pill can be started from the time the woman starts to menstruate. So we can actually offer contraceptive, the oral contraceptive pill to women who are sexually active and started their menstrual cycle. And it can go all the way to menopause, right? Depending on your risk factors, right? So if you are at risk, as I said, for certain types of certain conditions, then we would not recommend continuing it all the way to menopause. But as long as you are low risk, healthy, you've been using the pill without any incident, then you can use it all the way to when natural menopause occurs. And to answer the second question, the copper T, which is the intrauterine device that does not have hormones in it, that actually does not affect your menstruation in any negative way. You have regular periods every month, and women have not really complained or given any negative side effects in terms of the menstruation, right? But the Marina, which is the hormonal contraceptive, the one that is an intrauterine device, but it has the hormones in it, that has an effect on the menstrual cycle because it's hormone based, right? And it would cause sometimes very light periods, no periods, or irregular periods, right? Because of the hormone in it. So I hope that answered your question.
Yes, it does. Thank you very much.
Thank you. Thank you, doctor. So we have a question in the chat. How long after you have started the injection does it take effect?
Good question. So it's almost immediately. It's almost immediately. So what we recommend is, if you are not using any other form of contraception, and this is the first time that you are using the birth control, which is the injection, within that 3-month period that you're using, that you got the injection for, we recommend using additional forms of contraception, right? Because the effects of it would not be immediately, but it's almost immediately. So like within the first week or 2 of getting the injection, we recommend additional forms of contraception, which would include like using the condom or so. Yeah, because it has to have an effect on your ovulation. That's producing the eggs.
Okay, and how long? So how long do you use that additional contraceptive?
Right. So within the first 2 weeks
2
of
weeks.
getting
Okay,
the injection. Yes,
first 2 weeks.
of
Okay.
getting the injection. Because that is generally, especially if you have a 28-day cycle, meaning
Right.
that every 28 days you would menstruate, then chances are within that period of time is your most fertile time, and it will give your body, it might take a little time for the effects of the injection to work on your ovaries. Unlike the contraceptive pill, where once you use from the first day, you would start having contraceptive effects using the oral contraceptive pill.
It's more immediate. Understood. Wow, great. I am not seeing any additional questions in the Zoom chat. I see there was a comment in the YouTube, but I'm not sure what it was referencing. It mentioned, I didn't know that it's still in use. So maybe it was one of the maybe less popular contraceptives that you would have mentioned. Someone is querying.
Okay.
If you want to post in the chat, if you still have time to probably mention what it is you wasn't sure what's still in use, we could address that. All right, so I am going to hand over to our women's ministry leader. I'm sure she has some comments, some questions. Okay, and I'm seeing someone just asked something about Eloria. So we will take Sister Douglas, and then I guess you could address Sister Sullivan's message in the chat about, how do you pronounce it? Eloria.
Okay, hi, pleasant evening. I'm not going to be long.
Sure.
It was really informative. Again, I wish I had all this information before having my children. But my question is, how would a woman prevent an ectopic pregnancy? Because I had one, and I thought I was pregnant, going through the the pain and that kind of thing. But how would a woman be able to prevent that from occurring?
Good question. Now, you can't prevent an ectopic pregnancy. What can happen is you can basically have you would know your risk of developing an ectopic pregnancy, but in terms of preventing it, you can't prevent an ectopic pregnancy. The only way you can prevent a pregnancy is contraception, right? Now, an ectopic pregnancy is pregnancy that occurs outside of the normal place, which is within the womb, right? And if it occurs, say, like in your tubes, for example, if you are at risk of, if you are, say, have like infections in the tube, or you've had an ectopic pregnancy before, then your chances of developing an ectopic pregnancy is greater. But in terms of preventing it, you can't actually prevent an ectopic pregnancy. You can know the risk and know that if you're at risk of developing one or getting an ectopic pregnancy.
So there isn't a category of persons who are more prone to having ectopic pregnancies. It can happen to anyone.
Right. There are people who are at a greater risk of developing an ectopic pregnancy. So women who have had a previous ectopic pregnancy are more likely to develop another ectopic pregnancy. Women who have had tubal surgery, they're at risk of developing an ectopic pregnancy. For example, tying of your tubes. Women who have had infections, pelvic inflammatory disease, where there is, remember I spoke about the adhesions earlier, they are at risk of developing ectopic pregnancy. So yes, there's a category of women who are at a greater risk. But if you don't have any of these risk factors and you develop the ectopic pregnancy, well, you would have been one of, the category that didn't fall into the high risk category to develop it, but the type that unfortunately just got the ectopic pregnancy.
Okay, understood. So we'll take these last two questions. So you can mention about the Elora. I hope I'm pronouncing that correctly.
No problem. So the Elora,
Go ahead.
The Elora is similar to the Marina, it's just a different brand name. So the generic name is intrauterine contraceptive system, right? There's the IUS, the intrauterine system. And the intrauterine system is basically the birth control that you insert into the womb. And they're different brand names. So Mirena is just a brand name for it. Elora is another brand name. So they're the same thing. Yeah, just a different brand name. So it's similar to the Mirena or the intrauterine system, right?
Great, and it's just as effective.
Yeah, it's the same thing. Just a
Great.
different name.
And someone asked, what about pre-menopause and pregnancy? So that's probably a very heavy topic. So maybe you could just give us something very brief. Maybe are you asking about what are the effects of getting, or what are the likelihood of becoming premenopausal and being pregnant? Sure. That is a question. She said yes.
Okay, so the chances of getting pregnant perimenopausal around the time of menopause. All right, sure. So women who are around the time of menopause, actually, believe it or not, they have a chance of getting pregnant because you would have what we call the sporadic ovulation that can occur. Now, your fertility decreases closer to the menopause. From over the age of 40, your fertility significantly decreases. However, around the time of your menopause, you have these sporadic eggs that are being released. And a lot of women are not very careful during that time because they're thinking, oh, I'm already 48 or I'm 47, I can't get pregnant because I'm going into menopause anyway. And no, I have a 47-year-old pregnant woman in my clinic right now. So because there is these sporadic eggs that are released around that time, and you can very well get pregnant. So to answer your question, yes, although fertility decreases closer to the menopause, there is still a chance, and it's a very, very real chance of getting pregnant around the menopause.
Wow, that is something to really be mindful of at that age, to not let your guard down.
No, do not.
Too soon.
Don't get catch. According to the women, don't get catch.
There's an expression in the chat, Lord. You know, like, yeah, don't let that happen.
Yes, so that's why we say that contraception can go all the way until natural menopause, because you can become pregnant at 47, 48, 49, because I have 47 and 48-year-old women very pregnant.
And then they're higher risk being pregnant at that age, right?
Yeah. Extremely high risk, yes, correct.
Wow. Well, Dr. Livan, I must say a tremendous thank you for this very, very informative session. Your knowledge, it goes very deep. I can tell that you have such a wealth of experience, and it just was so effortless for you, right? Is there any way persons can contact you if you offer private services, or is it that they have to come to the Sandy Grande Hospital if they would like to utilize your services?
I don't offer private services, but as I would have mentioned to you before, my absolute desire is medical missionary. I just want to do everything for God. So my number, I can give it to you guys. You could feel free to contact me at any time. If I don't respond, I'm either sleeping or in surgery or doing some emergency, but I'll definitely get back to you. And I will be so happy to answer any questions, any help that I can offer. I am at your service, and I'm at the hospital. So that's generally where you would
operate, and the Sandy Grande.
At the Sandy Grande Hospital.
Excellent.
So Alyssa, I'm not sure if you could pass on my number.
Yes, I'm gonna put it in the chat right now, so persons can get a hold of you if they need to. Let me just post that. if you're on YouTube, feel free to join the Zoom so you can get access to her phone number.
Yes.
Right, so let me
And I'm
just
at your
post that
service.
here. So thank you for making yourself available and
thank you
extending
for having
your
me.
services to the community, the church community, and you know, we really appreciate that selflessness, that you're a medical practitioner, but you're also a missionary. So
Oh,
that
definitely.
is very
That's what we
much,
call to do. That's what we're
yes,
called to do.
that's what we're called to do. Exactly.
Yes.
So we're
So it
just
was
gonna
my
end with,
pleasure.
yes, thank you so much. I see you're getting some hearts in the reactions there. Persons are very much thankful and appreciative of the information shared. Just a reminder to our viewership, we meet every fourth Thursday of every month. We meet on Zoom. That information is usually shared in the church chat. If you're interested in joining the New and Expecting Mothers support group, you could just message us, send a message in the YouTube chat or in the Zoom chat, and we will add you to we have a WhatsApp group, and then we meet on Zoom every the last Thursday of every month. We don't always go live on YouTube. So this was actually our first YouTube live session that we've had since we started the group. And it definitely was indeed a well-deserving program to be broadcast to a wider viewership, because I'm sure our viewers will very much enlightened and informed and are grateful for this session. I would ask Sister Douglas, our women's mission leader, if she wants to make any comments before we pray to close.
I just want to say thank you so much, Doc, for all the information shared. And we want to invite you again when you're not totally wrapped up, because we really love to have a part 2, because we have so many issues we really want to discuss that will really help us as mothers. So thank you. God's richest blessings upon your ministry. And I know that it's only blessings. So thanks again. Have a great night, everyone. And thanks for joining.
Thank you, Sister Douglas. I'm just going to offer a word of prayer. Dear Heavenly Father, we thank you for this beautiful platform that you've opened up for us to discuss reproductive health, to discuss family planning and contraception, dear Lord. Thank you for providing Dr. Livan, dear Lord, giving her the education and the experience and the confidence and the willingness to be a part of this session and to share her knowledge and expertise with us, dear Lord. Thank you for the questions that were put forward, dear Lord, and we appreciate the empowerment we have all received after getting this information. So bless the doctor, dear Lord, and I pray that you will continue to open up other opportunities for her to be a missionary and to use her God-given gifts to edify and to bless others. Be with those within my hearing, dear Lord, and let us enjoy the rest of the night and continue to keep us safe. In Jesus' name, amen. Have a wonderful night, everyone. To my team, thank you for the support as always, and we'll see you guys in 4 weeks. Bye.